Hello, I'm Dr. Charles Durr, and I'm here to talk to you about our IBS program. So before we get started, these are just a few of my bona fides. If you'd like to pause this video and take a closer look, these are my functional medicine credentials, some of my functional, chiropractic credentials, and other credentials there as well. So feel free to pause and take a closer look if you like. So we're going to talk about irritable bowel syndrome. All right, so what are the triggers of IBS? So what causes the cramping, the spasms, the bloating, the diarrhea, and constipation? Right, so we're going to talk about that today. In my experience, since opening this practice in 1999, I've come to categorize it in three general categories: foodborne IBS, blood-borne IBS, and neurotransmitter deficiencies. All right, so we're going to go into detail on all of these types of triggers. Right? But first, let's talk about hypochlorhydria. Now, that's just a fancy word that means low hydrochloric acid. Right? So that's a condition where either you do not secrete enough, or you're taking an antacid to suppress secretion of hydrochloric acid, which is critical to break down proteins. Right? So some of the symptoms of hypochlorhydria are feeling that your bowels don't empty completely when you go to the bathroom, lower abdominal gas, alternating constipation, diarrhea, hard dry stools, coated tongue, a lot of smelly gas, right? More than 3 bowel movements daily, and using laxatives. Excessive belching, burping, or bloating, gas after a meal, offensive breath, difficult bowel movement, sense of fullness. You eat and you're just, oh man, just feels like it's sitting there. And undigested foods in the stool, very good indicator that you have hypochlorhydria and you're not breaking your foods down. All right. So why is that important? Well, it can lead to a condition called intestinal permeability. And the reason being is that your immune system is keyed up to look at proteins. Hydrochloric acid breaks down proteins into their constituent peptides and then into individual amino acids. These can pass freely through the gut barrier, and they go undetected by your surveillance B cells, your antibodies. But when you suppress or you don't have enough hydrochloric acid, the proteins are not broken down completely, and then they present to your immune system as something that doesn't belong. So antibodies are surveilling your bloodstream, looking for proteins that are foreign or unfamiliar. And so if they are constantly seeing gluten protein or dairy protein or corn protein that's long and has many amino acid chains in it, it's going to attach to it, signaling the T cells to come out and attack that protein every time you ingest it. And so this can lead to breakdown of the digestive barrier, aka leaky gut. Right? So the signs of you may have or to be developing leaky gut are increasing food reactions. Eating certain foods, you get gassy, bloaty, diarrhea, any number of reactions. Unpredictable food reactions, so you don't know where it's safe to eat sometimes because something could set you off. Unpredictable abdominal swelling, frequent bloating and distension after eating, and a lot of intolerance to starches and sugars. Right, so if you have these symptoms, you're either developing or you have intestinal permeability, aka leaky gut. So this is where it all starts. If you're developing leaky gut, then the proteins that you're ingesting that aren't being broken down are presenting heavily to your immune system, creating a large memory bank of antibodies that then creates a vigorous reaction, inflammatory immune response, every time those proteins are ingested. Now, what you're looking at here is array number 2 from Cyrex Labs, the Intestinal Permeability Panel. Now, as far as I know, they're the only lab in the country that provides this level of detail and accuracy in testing for intestinal permeability, aka leaky gut. They test for actomycin. Actomycin is the cytoskeleton inside the stomach cells that hold it up. It's the erector set, basically. Right? So if you have antibodies against the actomycin, that means you have intercellular permeability. It's breaking down through the cell. The zonulin and occludin networks, these 3 tests here, are the sewing thread that hold the cells together. And so if you have antibodies to the zonulin and occludin network, that means you have intercellular intestinal permeability. And then these last 3, the lipopolysaccharides, these are also known as biofilm. So biofilm is specifically created by a gram-negative bacteria. It's a defense mechanism, adaptive mechanism by the bacteria that protects them from our immune system both in detection and in killing. They're very resistant to antibiotics, and they create a problem with the zonulin-inclutin network is that they don't break the zonulin-includins, but they make them stretchy so that your stomach lining can distend and food can pass through those threads, so to speak, that have been stretched out. The biofilm also creates blood-brain barrier permeability, which can lead to a lot of brain inflammation and other related problems. And it's very resistant to antibiotics and natural treatments to kill these bacteria. Okay. So we'll get into biofilm a little bit later. Now, TILT, toxicant-induced loss of tolerance. That's when you've had such bad leaky gut and you've lost the mucosal layer. Right? So the mucosal layer is the layer that sits on top of the gut barrier. The mucosal layer has a protective mechanism in that it helps present antigens or present proteins to certain Peyer's patches in the stomach before it goes into the bloodstream, so that your immune system can kind of take a preview of what the protein is and not overreact to it. So if you lose the mucosal layer and then you lose the gut barrier, you can then develop what's called TILT. And it's characterized by intolerance to smells, jewelry, lotions, potions, and a lot of skin outbreaks and chemical irritations. So if you progress to this point, you've lost your mucosal layer, you've lost your gut-brain barrier, your gut barrier, and your immune system is so flooded with presentation of antigens, whether they be foods or bugs or the environment and the toxins, that you're reacting to everything now. All right? And this is an issue that's very common, and I see a huge correlation with people with irritable bowel syndrome. All right? So let's talk about antigens. Now, antigens are simply something that your immune system thinks is a threat to your health. Right? Generally speaking, people think of that as bacteria and viruses and parasites and things like that. But the antigens can be detected in blood testing. An IgE reaction is a true allergy. So you have an allergic reaction. If the peanut you get to the hospital, you have anaphylaxis. That's a severe IgE reaction. But generally it's consisting of skin breakouts and swelling and histamine release and coughing, sneezing, itching, and very severe reaction within minutes to hours after ingestion. And so most people know they have an allergy because it's rather obvious. But there's other reactions, IgG and IgA. These are what we call delayed onset humoral reactions. And they're characterized by fatigue, brain fog, bloating, and joint pain hours to days later. So you may have something for dinner and feel fine, and then wake up in the morning, feel like you have a hangover or hit by a train. And so IgGs and IgAs aren't always associated because you don't notice until the day or two after, and so you don't put two and two together. But usually the IgG-IgA testing uncovers what is not so obvious and allows us to design a diet that is better for IBS. Right. So the food-borne antigens, these are the most common triggers. Gluten, dairy, corn, rice, soy. We call these the big nasties, meaning that they're notorious, either because they're all grains or they've been genetically modified, or we ingest a lot of them in the standard American diet. So increased virility of these proteins and increased ingestion means more familiarity, more of a memory bank for your antibodies, and more of a severe reaction. Right. So what you're looking at here is array number 3 from Cyrex Labs. It's their gluten test. And you can see there's 26 foods on this test. As far as I know, this is the most thorough and complete gluten test there is. It's rather expensive, but if you really want to know if you're gluten sensitive, this is the creme de la creme of gluten sensitivity testing. I don't find it necessary always to do that. Most people have found out one way or another they suspect gluten. But if someone really wants to know, we'll order this test, and it'll be definitive as can be. This is array number 4 from Cyrex Labs. This is called the cross-reactive panel. It means that these foods are cross-reactive to gluten. Right? So the foods from coffee, yeast, oats, chocolate, milk chocolate, I should say, whey protein, cow's milk, and barley, rye, Polish wheat, and spelt are all cross-reactive to gluten, meaning that the protein structure is very similar. And there's 21 amino acids in a protein. Right? So if you have as little as 9 amino acid sequences in a row that are identical, and you have a compromised immune system, you can mistake that protein for another one. So the implication here is, okay, I've gone to the misery of eliminating gluten from my diet, and I don't feel any better. Well, the chances are you are eating one of these cross-reacting foods here. Now, the beauty of this report is everything below coffee, sesame, buckwheat, all these grains and commonly eaten foods in place of gluten, right, are on here so that you don't jump out of the frying pan into the fire. So you go to the trouble of going gluten-free, but then you're eating, you know, a hemp or a millet or a quinoa or an aramath, and you're still getting an inflammatory reaction. So this is an excellent test for identifying food-borne antigens in somebody with IBS. Now, let's talk about bug-borne antigens. So bug-borne antigens, microbial imbalance, or what we call dysbiosis. Right? It can be an H. pylori. Everybody's heard of that. It's implicated in ulcers and, you know, a lot of problems with the upper digestive tract. It's very common bacteria if you have pets. If you're cleaning their bowl, they're licking you, or anything along that lines. It tends to be very contagious, but it's very highly associated with digestive disorders. It likes to infiltrate the upper digestive tract, particularly the stomach, and contribute to hypochlorhydria. Right? So they infect the proton pumps. Bacterial overgrowth. All right, so bacterial overgrowth could occur in the small intestine, what we call SIBO, could be anywhere. Generally, these are what we call commensal bacteria. They're not going to kill you, but they don't help you, and they compete with the helpful bacteria, that your probiotic bacteria, and they will inhibit their population. Right, so probiotic bacteria, the reason they're so good is that they, help break our food down. They digest our plant sugars for us, and they help with resorption of cholesterols and many key nutrients in our digestive tract. Yeast overgrowth, all right, very common problem, very hard to kill. All right, intestinal virus, parasites, all can be tested through various forms of testing. All can cause IBS of one course or the other. And if we find biofilm that we had mentioned earlier, all of these things are going to be really hard to kill. Biofilm is a film, and the bacteria secrete it, and they live underneath of it. There's actually strata, two or three layers, in which there are incubators, and then there's juveniles, and then there's adults. The bacteria can transmutate with viruses, and Lyme disease bacteria, Burgdorfia and Bordetella, secrete prodigious amounts of biofilm. That's why it's so hard to kill the yeast, I should say the Lyme disease. Very hard to kill because of biofilm. Right? So we go back to array number 2, the intestinal permeability panel. If we find positive antibodies to the lipopolysaccharide, you have biofilm. You have gram-negative bacteria living in your body, most likely in the gut, but it could be some other smooth, moist surface like the lungs or the, heart, or any number of places. All right, so biofilm is a game changer when it comes to trying to kill dysbiotic bacteria. You have to degrade the biofilm, and we have several. So I have several protocols to do that. I have gentle ones, I have aggressive ones, and I basically judge that based on the metabolic health of the patient, which one they're ready for. But biofilm, very, very, very critical to resolving irritable bowel. But we can use straightforward blood work from the traditional commercial labs that can tell us if there is some sort of microbial load in your gut. We do a CBC with differential. I mean, this test is literally $6. You can see neutrophils. We've got bacteria. If it raises above 60, lymphocytes, if we see that number raise above 40, eosinophils, we're suspecting yeast or parasite. Right? If that raises above 4. Right? So those are indicators that you have some sort of microbial load if there's alterations in these numbers. What we know is that there's a certain ratio of neutrophils to lymphocytes to eosinophils and so forth. And so if the ratios start to change, then we know that there's an active bacterial, there's active virus, or I should say a yeast or a parasite. A simple test, 1,25-OH vitamin D tends to elevate when there's an active infection. once in a while I see that associated with autoimmune disease, but I've seen a near 100% correlation when this vitamin D, not the 25, but the 125 gets above 75. If I see that above 75, I see an elevation of neutrophils above 60, I'm thinking there's an active bacterial infection coming. Right. Now, we talked about the lipopolysaccharides, and then we can also do stool microbial testing. It's basically a test that will do an inventory of your probiotic bacteria. It will look for the unhealthy bacteria, the pathogenic bacteria, yeast, and parasites, all in one handy-dandy test sample. So it really helps us direct our ammunition in terms of trying to kill bugs by identifying which ones they are and so forth. And so those are the tools that I use to identify the bugs. Right. Now, we've talked about food-borne or food-triggered IBS. We've talked about bug-borne or bug-triggered IBS. And a third category that's very commonly missed is neurotransmitter-based IBS. Right. So, increased cortisol, catecholamines, and CRH indicate there's an active stress response. These hormones are released in the presence of a fight or flight response. All right? So we'll go into that. GABA is a neurotransmitter that's responsible for calmness. It's what we call the brakes of the brain. Right? So when you go back and look at these hormones, if they're being released, it's because there's an increased stress response. All right? It could be chronic or it could be acute. In the chronic, they're very harmful. In the acute, they can save your life. Right? So if you're having these fight or flight responses, what's happening is that your brain is saying, we're in danger. And they're sending an electrical signal down to the adrenal gland that causes the release of those hormones that increases blood sugar, it increases heart rate, it increases what we call sympathetic tone. The sympathetic nervous system is the one that makes you fight or flight. All right? The parasympathetic nervous system is the feeding and the breeding. Right? So what happens is when you're in an active fight or flight response, your sympathetic tone goes higher, your parasympathetic tone goes lower. Blood is shunted from the gut into the extremities so that you can run away or fight. Right? So obviously if there's a large organ system like the gut, it needs a lot of oxygen and blood supply to work properly. GABA inhibits the fight or flight response. It's what keeps you calm and relaxed. Right? So I found that many people who have a deficiency of GABA have irritable bowel syndrome. It tends to be towards the diarrhea, not the constipation. But anxiety, dread, knots in your stomach, being overwhelmed easily, restless, you can't turn your mind off, disorganized attention, all these things are signs that you may have a GABA deficiency. Very, very common in irritable bowel diarrhea style. Right. Now, we use auricular therapy, somatosensory evoked potential, and vagal stimulation to increase vagal tone. So we'll talk about the autonomic nervous system. I was mentioning this earlier. This little section here called your middle brain stem, the mesencephalon. All right. You can see this nerve here that flows down to the heart, the lungs, and all the gut organs. That's your parasympathetic nervous system, your vagal nerve. All right. The sympathetic nervous system, these yellow guys, are the ones that create fight or flight. So homeostasis is a balance between the two, feeding and breeding, and fight or flight, and rest and restore. Right? So auricular therapy, somatosensory evoked potential, and vagal stimulation, guess what they do? They increase vagal tone. All right? So we touch your ear and your tongue with these electrical signals, like electroacupuncture, and it upregulates activity within the mesencephalon, which then gates the sympathetic nervous system, stops its outflow, and increases the vagal tone and the vagal outlet. All right, so if we can do that, the gut gets more neurological stimulation, more blood flow, and more relaxation. All right. Now, one thing I failed to mention is that somebody who has a decrease in dopamine, right? I didn't mention it on the slideshow, tends to have IBS-C, right? So they tend to have constipation. So if you have any history of an angry depression, or anybody in your family has developed Parkinsonian type symptomologies, losing your sense of smell or taste, difficult swallowing pills, you gag easily, these are signs you may have a deficiency of dopamine, and that can create a lack of contraction in the gut And constipation is one of the first signs that you're developing early Parkinson's disease. So we look for the dopamine issues as well. Right, so vagal tone is important to have the feeding and breathing part of your nervous system working properly. So what is my process? Well, first identify antigens. Antigens could be foods, they could be bugs. Right? We do food sensitivity testings. We create a specialized diet for you to eliminate foods that are going to trigger an inflammatory response in your gut so that things can calm down. We also identify bug-borne antigens and biofilms. We kill those bugs, we degrade the biofilm, and we restore the healthy probiotic bacteria to your stomach. We go through gut repair. All right? So we increase tolerance. Tolerance is when you are exposed to an antigen, what is the response? Is the response appropriate? And does it resolve properly? So most people who have irritable bowel have an unresolved antigenic response that doesn't quite finish ever, right? And it's exaggerated in its response. So by fixing the gut, both the gut lining and the mucosal layer, we can increase tolerance to the exposure eventually so you can start eating normally again. So the goal is eventually to have you eat a very varied diet that's healthy, based on vegetables and healthy protein sources, sprinkled in a few grains here and there, but identify the most antigenic proteins and limit them eventually to just occasionally. But in the beginning we have to eliminate them long enough so you can desensitize so that we can restore tolerance. Right? So gut repair and mucosal layer restoration are step 2. Immune modulation, vitamin D and glutathione. These are what are going to create the proper response to exposure to a protein. So if you have low vitamin D and low glutathione, you're going to overreact and you're going to cross-react. So it's going to be exaggerated response against self-tissue. Right? It's not going to be targeted at the antigen like a bug that should be killed. So vitamin D and glutathione restoration are important. We restore deficiencies, whether it be the mucosal layer, whether it be vitamins, whether it be proteins, or whatever it may be. And then we increase the vagal tone, like we talked about. We balance the parasympathetic and sympathetic nervous system. And so that's my process. That's how I approach IBS. It's been very effective for many people. And if you're interested in getting analyzed and maybe getting consultation with me, please call the number you see here or refer to some of the links that you see on the website here. In the meantime, I thank you for watching. Hope to help you soon. Bye-bye.